This is a patient lying supine. When you are doing a jugular puncture, you are at the head of the patient, and when you are doing a subclavian puncture, you are standing at the patient's side. Since this is the subclavian anatomy, this is roughly the perspective of the person doing the subclavian procedure. Zooming in slowly, you can see the first rib here, and the tight space between the first rib and the collarbone here. Ultimately, what you are trying to do is puncture the subclavian vein. If we change our perspective to look from the head down, you can see that the vein does not sit directly behind the clavicle. Rather, it is a little bit posterior. Looking from the top, you can see that the target is deep to the lateral part of the middle third of the clavicle. That spot is a good estimation for your puncture point. Turning our attention to looking at the artery sits a little cephalad and a little posterior from the vein. If we look from the view of the top of the head and the en face view, this shows that the artery relates to the vein because it is posterior and superior, meaning it is closer to the bed and closer to the patient's head. Looking back to the perspective of the person who is doing the puncture, they have to imagine the needle tip coming in at roughly the lateral part of the middle third of the clavicle. However, to get underneath the clavicle, you have to enter some distance away. This means you have to enter several centimeters from the inferior surface of the clavicle. The trajectory is 45 degrees to the long axis of the body and above the suprasternal notch in relation to the clavicle.